Hi everyone, welcome again to the McLean Hospital Borderline Personality Disorder Education webinar series. My name is Chris Palmer. I'm the Director of the Department of Postgraduate and Continuing Education. It's my pleasure to welcome you today. Today we're joined by Maureen Smith, who is a clinical associate and former Director of Family Services here at McLean Hospital in the Gunderson Outpatient program, which is a program that specializes in the treatment of borderline personality disorder. It's going to largely be an open conversation with Maureen, and so we're hoping for a lot of interaction from all of you who are participating live in this webinar. So before we get started, a few logistical announcements. All of your microphones have been muted, and your names and identities are hidden from other participants so that you can remain anonymous. However, as I said, we do want this to be very interactive. You'll notice in the lower right-hand corner of your screen a Q&A box. So if you've come to this webinar with specific questions or challenges, we encourage you to type those in even right now so that we can put them in queue, and we'll get through as many of those questions and conversations as we can. In the lower left-hand corner of your screen, you'll see web links for a variety of resources. The very first link is actually for our homepage, where all of these webinars are stored and archived, and so you can view any of them, including another one by Maureen Smith that she did earlier. The next three links are general resources around borderline personality disorder, where you can get information about borderline personality disorder, and also where you can sometimes get referrals for clinicians in your area. And finally, I just want to, again, remind people that these webinars are made possible through a generous philanthropic gift from a family affected by borderline personality disorder. We would love to be able to continue these, but we'll need philanthropic support in order to do that. So if you're in a position to be able to give a gift, large or small, we would very much appreciate it, and it would certainly support these webinars going forward. And so that fifth link in that box allows you to be able to give a gift. And with that, I'm going to turn the webinar over to Maureen Smith.
Well, I guess it's good morning. So this is a midday webinar, and happy to have you all here. The topic today is actually one that's very familiar to me, because I've often gotten calls over the years from people saying that I don't know, that call and say, I think my kid, my spouse, my parent, a good friend has borderline personality disorder. I've researched it, and they have a lot of issues and problems, and I've researched it, and I think this is really it. And I want to let them know about it, and I want them to get treatment, and how do I tell them? And that was sort of one of the thoughts I had about addressing this issue today. I want to talk about it broadly, and my focus tends to be parents who come looking for help for their young adult or adolescent young adult children. And I think those are the people who are most invested, often most impacted by the symptoms of borderline personality disorder, so they're often most invested in trying to affect change. But this applies to any family member, and each situation is a little different. So I'm hoping that people will write in their questions, and we can have more of a sort of dialogue about things in a more specific way. But right now, I want to kind of go through some generalities around discussing this, particularly with somebody who you haven't really brought up the topic before, that you might have sort of done the research and found that this may be really helpful to a family member. So the first bullet, and are you going to do those, Don? Okay. These may seem obvious, but they're worth talking about. Not to bring up the subject during a time of crisis or even in an argument. And this, we all know that when we're in high emotion, we don't think straight, we're often not strategic, we don't frame things well, we're very emotional, and unfortunately, this is what often happens. It's in a time of crisis where a parent in particular might say, you have borderline personality disorder, this is what's wrong with you, and it poisons the water for this topic of like what is the foundation of what your loved one is struggling with. So it's very tempting, and it's hard not to bring this up when things are going awry, but I urge you all not to, in a time of high emotion, to try to talk about this subject because it tends to backfire. The second point, and these sort of follow, about the idea of labeling. A lot of patients have told me that they are very offended by saying, you are BPD, as if they're not a person, that they're a diagnosis. And I know that family members often worry about the concept of labeling. So I think it's something that it's important that we think about our language. The idea that I know who you are is very offensive to others in general, and certainly when you're talking about someone who you feel has BPD, which then means this person is highly interpersonally sensitive, is reactive, has problems with anger, has a negative filter, so you have to be really careful how you present very important topics, and not to sort of say, I know who you are, I know you better than you know yourself, because that's really undermining, and you're going to get a door closed. One of the things that I hear parents say a lot is, I really understand her. And the patient herself will say, I don't understand me. How do you do that? And there's really a pushback against somebody knowing them better than they know themselves. So it's just a point to kind of keep in mind. And again, I'm talking through the lens of parents talking to their children, but again, I think this applies in general. So the next bullet, which would follow up, is, and I'm going to be talking about this a lot, is using this sort of a curious stance, a not knowing stance when talking about this. And this is a little counterintuitive. One of the treatments for BPD is called mentalization. And one of the wonderful things about this treatment is they really help therapists take on this kind of curious, tell me what your experience is, rather than the idea that a lot of people have that therapists know what's going on with the patient. They'll go tell them what it is and the patient will be calmed, rather than the idea that really the patient themselves needs to begin to understand on their own what's going on. And you need a guide, you need somebody who is interested, who asks questions, who kind of explores. So when you're bringing up this topic, it's important to say something along the lines of, I'm not sure, but I've read about something called borderline personality disorder, and it seems to fit because these are certain aspects about it that I see you suffering with. And that's a much better approach than kind of trying to lay this on. And also, I just want to say as an aside, it is not one disorder that everybody has in the same way. It's, as you know, if you listen to the webinars, it's very much of a spectrum disorder, and people present, there are some core issues that are pretty universal, but people can present in many different ways, and some have a lot more crises than others, but the kind of struggling that exists has a foundation that's similar. And then the last bullet would be, again, following this. This is DBT, dialectical behavior therapy language. Observe and describe. Never act like you are the expert. And the other piece in this, which is very key and very difficult to do, is to be non-judgmental. People with borderline personality disorder are very, very sensitive and very much can hear what you're saying as an insult rather than being helpful. And I think many of you probably know how delicate it can be. But being brief and clear and sort of saying what you see and trying to present it in kind of a neutral way, these are skills that are challenging and hard to do, which goes back to why you never want to do it when you're in an argument with somebody. But it can make all the difference in the world and is very important when you have something, a piece of information that you feel could be vitally important to your loved one. So I'm just going to go to the next, and then the last one. Thank you, Don. Be prepared for pushback. This is also, as any of you who have had somebody that you love struggle with this, it is a long haul. And oftentimes you will present things and you will get a no, you will get a pushback, you will get a very much of a rejection of what you're saying, but you have to not be discouraged by that, but you can't keep pushing your point. If there's pushback, step back, let it go, and you can bring it up at another time. But engaging in a struggle is going to poison the waters once again. So the next slide and the next thing I just want to address before we open it up to questions is about treatment. And there are many treatments that have been proven to be very useful for people with this disorder when, again, I'm thinking about parents because they're so invested, but when they read about them, they're very eager for their family member to get some treatment, some therapy. The biggest one that always gets a hit is dialectical behavior therapy. It's the most well-known and has shown very good results. It's interesting. It's manualized, so it's something that you have a workbook, and people always feel a little more reassured with that. But if you raise this idea that you need therapy, again, similar to the crisis, in the middle of an argument or in the middle of a crisis, you will again poison the waters. Somebody with BPD will hear that if you think I'm a loser, you think there's something wrong with me. Well, let me tell you, there's something wrong with you. You know, you're going to get that kind of pushback, and also a possible negative association that therapy means there's something wrong with me. Now, most people with BPD, they are terrified of what is going on with them. Why do they have such a hard time moving forward in life? They're smart, you know, they have the same kind of supports that other people have, and yet they struggle. So it is very terrifying, and the idea of therapy can also be something that somebody has to get used to, or actually meet somebody and sort of see that this can be helpful. But you can't really push this agenda, or you will have somebody refusing it just for the sake of refusing it. So this goes to the next one, which is avoid selling treatments. I can't tell you how many times I've had somebody come in my office and say, you know, my mother wants me to do DBT. I'm not doing it. She should do it, you know, and I'm happy for her to do it. But it becomes part of a struggle and an argument that has no base. It's not about DBT. It's about what can you make me do, and what can I refuse to do to feel like I have some autonomy, even though I may be shooting myself in the foot, which is something that people in a struggle will often do. And it's really a shame because people can just, especially people with BPD, they can have this emotional association to it and just feel like I've seen so many patients who are like, I didn't want to do treatment for so long. You know, I just didn't. It would have been the confirmation that something's wrong with me. So again, you want to be careful not to poison the waters. And again, going back to this curious, exploratory stance, and I want to stress that it's not just tactical or strategic, but it's also essential for there to be this sense of collaboration. People with BPD really want you to pay attention, to kind of, they often do things that get negative attention, but they want your interest. They look for that. There are many, many kinds of treatments that can be helpful, and one of the things that's good about an early, if somebody can get to a therapist and kind of meet them, that's often the first step, that there are many treatments that some people, that work for them much better than others, but there are a variety of things, and I think as we've seen through the long-term research that's been done here, that in many ways a solid therapy is like the most important thing of all. So you don't want to try to be selling something that you have heard is very effective. You want to be careful about that. And then I think the last thing is, again, not to get discouraged. What you want to start is a conversation about this rather than an advice giving and telling the person you love what to do, because that's going to be less effective than, again, saying plant the seed, kind of saying something in a non-judgmental, interested, concerned, I'm not sure, but this is what I think way, tell me what you think or think about it or tell me what your reaction is much more fruitful ultimately than having this be embedded in a struggle, a false struggle for independence or autonomy, or you can't tell me what to do kind of thing. So with that, the last slide, and I know there are many resources available, but it's good to have one and a few simple ones at your fingertips so that if you do luckily encounter someone who's interested in learning more about it, you can say, look at this website, rather than have your loved one just go online and possibly find some bad information or information that is actually not accurate about the disorder, and there's lots of stuff out there about BPD. So these are really solid resources. I do want to highlight the National Education Alliance for BPD website. They have videos and tips for families and patients, and they have the diagnosis that's clearly sort of outlined there. So have those in your back pocket in case somebody is interested and wants to learn more. So those are just some beginning thoughts. There's lots to talk about with this. I don't know if we have anything that's come up that we could do. Okay.
We do. So let's move right into the questions. Mm-hmm. So one person says, my daughter did a diagnostic survey at age 21 at a dual diagnosis clinic and told us that she had symptoms of borderline personality disorder, but that she did not have it. She's now 30, and I believe she has it in spades. I've addressed my concern to her therapist at a rare meeting, but the therapist says it's not productive to go there, so I'm doing this myself. She's agreed to try family therapy with me alone. She's estranged from her siblings, but even before the first meeting, we're running into problems with trust. So how do you think about this parent dilemma of, my daughter has BPD, it's unrecognized, she's in treatment, her treater won't even go there. Mm-hmm. Is she getting the best treatment? Is she getting appropriate treatment even? Mm-hmm. If the therapist doesn't think it's productive to go there?
Well, this is such a good question, and I may be a little rogue with my answer, but I do feel that everybody's personality is quite complex, and what we often see is what we would call a mixed personality disorder. So borderline personality disorder technically is, in the Diagnostic and Statistical Manual, has 9 symptoms, 9 qualities. What would be the word? 9. I think it's more symptoms. And you have to have 5 of the 9 to meet the criteria. I don't think that's especially helpful because if you only have difficulty in or chaotic interpersonal relationships, you only have one quality of BPD, that can really affect your life. So the idea of the label is less important than knowing what the qualities are. So it is typical to hear, I have a few of the qualities of the traits of BPD, but I don't meet criteria, therefore I don't have it. It's probably not an argument you even want to get into. Therapists, if this therapist, I would be curious, it sounds to me like you actually have a good opening because this therapist, while she may not want to use the term borderline personality disorder, because the therapist might feel that this is something the patient can't accept, if they are working on the symptoms that are problematic, that's the important part. What it's called, I know this may sound odd, but what it's called is not as important as what is actually getting in the way of your daughter's moving on in her life. Now, she's not talking to her siblings. That says a lot right there. The fact that, did the therapist recommend that they do family work?
So it's not clear to me yet, and we'll see if this questioner can put that in. But one additional piece of information that I did just get from this questioner is that the treatment is for complex PTSD. And that opens a whole other can of worms.
Talk about a can of worms.
But may also, but with some therapists, I want to just make the point that with some therapists can actually lead to therapists encouraging kind of disowning the family, siblings, parents. Like, you've got to get away from that toxic family of yours. They're the cause of all of your symptoms. This is why you're so ill. Mm-hmm. Let's get you away from all of those evil people. Yeah. And then your life will be great.
Yeah. Well, this is a huge red flag for me because I am a family therapist and I do think about especially this disorder within a family system because it's so critical. So that would be a huge red flag if, in fact, the PTSD diagnosis comes with it. You need to stay away from your family. What contradicts that a little bit to me is that if your therapist, whoever recommended that you and your daughter start some work together to work on trust issues, sounds perfect. And I really think that I do a lot of mother-daughter work on this, and it really does come down. I mean, trust is one way to address it, but sort of larger, deeper issues about the attachment. So I think it's a great place to start. I don't think you have to have this label, as long as, again, going back to observing and describing. So if you're included and you're going to start with her, I think that I highly recommend that you do that. And I wouldn't think it's with her therapist. That wouldn't be the best thing. It should be with somebody different because her therapist is hers. So I think what Chris pointed out about getting concerned if a therapist says you should not be involved as a family. I mean, even trauma work is not my forte, but I do feel that has to be really deeply examined before you go there, because oftentimes people with borderline personality disorder will present as, my family is horrible. This is the classic case. The families come into the emergency room to pick up their patients, and the ER staff is all like, oh, those horrible people, and they're there to bring her home because she was at home with them, and they're very worried about her. So it's, if there are situations, I'm sure, trauma situations where this might apply, but in general, BPD, family work is extremely important. So I'm encouraged about that.
So I do have more information, and it leads to another question. But I have more information on this particular case. So it was not the therapist who recommended family therapy. The therapist is actually recommending disengagement from the family for the exact reasons that I described. toxic family, complex PTSD, they're the cause of all your problems. And I bring it up because I don't think it's an unusual example.
Yeah.
It's a big theme in therapy nowadays. Toxic people in your life. Cleanse your life of all of the toxic people in your life and get them out of there. And one concern that I have as a psychiatrist and therapist is that a lot of patients with borderline personality disorder are looking for a reason for their pathology, or they're looking for a reason for their misery or their suffering or whatever. And when they're also very impressionable and can be persuaded to things like that pretty easily. And one concern that I have about this theme in popular psychology of cleanse your life of all of the toxic people in it is it kind of goes along with this, that, you know, that your toxic family must be the cause of your borderline personality disorder. So to get back to this case, the mother shared with me that she's the one who recommended family therapy with a neutral therapist, and the daughter sounds like at least willing to try it out. But I want to go to the second part of the question, which I think is a whole different question. If, for example, like in this case or lots of other cases, you feel that your loved one isn't getting appropriate treatment, and God forbid is getting treatment that might actually be exacerbating your symptoms or enabling your lack of progress in life, not holding you accountable, but instead blaming and shaming the family, and, well, until you get rid of them, you're never going to move on. Do you have any recommendations for family members in those cases where a person with borderline personality disorder is really attached to a therapist, but they're probably not getting good treatment, and sometimes they're even getting harmful treatment?
Well, I think it's a really common situation. I agree, Chris, so a couple of things to start with. This is classic that people with BPD often blame their family for many things, and their parents in particular. And in the Gunderson outpatient program and in residential programs, usually that's the first thing. It's my parents' fault. And that's the first thing you sort of tackle with the parents and the patient. And then everybody takes ownership of their own contribution to the problem, and then we move on from there. But it is dangerous territory. I would say, as a sort of sidebar, for people, for the person with BPD, if they're financially dependent on their families and either live with them or they pay for what they're doing, that is actually one way to kind of assess. They're really not independent, that they're tied to the families, and that you have to work. Our feeling in the Gunderson outpatient clinic is that, you know, if your family is supporting you, you have to collaborate with them. They can't be the evildoers, and still you're taking their support. So that's one thing. If you're farther along, like this case, this young woman may be out and no longer financially dependent and independent from her folks or her mother in this sort of tangible way. I really think that without exploring the situation, that it's too easy to say that this is a toxic family situation. And I don't really advise a big family therapy. That's why I like this kind of dyad, a mother and a daughter, whoever, you know, or some way of doing it. So what a family can do is say, could we, sometimes a consultation is hard to ask for because it's typically these patients know my mother doesn't like my therapist, you know, and that makes me like my therapist even more, you know, kind of thing. I have to say I've encountered a lot of therapists in my career who do not see this diagnosis and often are blaming of the family, and it's a really, really tough situation. And I've seen therapists who have never even spoken with the family, you know, I mean, and have a lot of opinions about that, which they've all gotten from the patient. We're really trying to get a lot of information out. We're doing there's a new manual coming out for treatment of BPD geared towards practitioners to kind of look at this disorder, because it often coexists with PTSD. So you often can have both, which makes it even more complicated. But I guess for a family, you have to be careful that you don't attack the therapist. You want to find a way in. This mother sounds like you've done a really great piece of work to at least get your daughter to agree to see somebody else, and then give permission, her therapist and the consultant or the family person you see, to be able to talk together. Because in the end, you may use that family therapist for yourself, the mother might, even if it fails with the daughter, but at least you're in somehow, and there's a way that you can get some information to the therapist. So I don't know if that's clear, but you kind of work the system in one way or another. But it's a it's not an unusual problem. So a tough one. Mm-hmm.
Thank you. No, I think that's helpful advice and helpful information. The next kind of theme or topic, we have two different questions,
okay,
but they both relate to children with borderline personality disorder being excessively dependent on the parent. And that is not an unusual theme at all.
No.
So I think we've got two great questions along those lines. So one is, my daughter has been diagnosed with BPD and has severe anxiety over abandonment. She begs me not to go to Florida to help my sister. She panics. She has other diagnoses as well, struggles with bulimia, depression, cutting, PTSD. My husband and her siblings are really not available as comforting people or resources, or just even available to stay with her when I go to Florida. So what can I do? How can I allay her fears, or how can I manage this?
Such a good question. So many things come to my mind. One of the ones is Perry Hoffman, who's the, I think she's the director of National Education Alliance. She has a wonderful cartoon of two ducks, parent ducks, that are kind of having a private conversation, and you see a little duck coming down the hallway, and they're like, don't look at her. She's going to ask us to drive her to Florida again. You know, the idea that there are some people with BPD who aren't counter dependent. They're totally given to their dependence, and it's really a challenging issue, because they can often bring up this feeling of abandonment, and a parent can feel very guilty about that, and it's a tough, especially it's sort of heart-rendering, especially if everybody else is sort of sick of it and you're the one left, and it's usually the mother. One thing that comes to mind, I don't know if they're on the list here, are the family guidelines. But one of the family guidelines that's very important is you set limits based on the limits of your tolerance. And I think that in these situations, you've got to do what you can do. Because I've often urged parents, go on that vacation, even though your daughter is saying, I don't know if I'll be safe, I don't know what I can do. You know, if you're at a point where you really are ready to do that, you're doing something for yourself that you feel is good for you, actually is a good kind of modeling for the patient. And it's also a vote of confidence for your daughter, saying, I know, what's essential in that is, I know you're going to be able to manage this. So one underlying sort of message that you don't want to give is, oh, I see you can't live without me, so I better be there for you all the time. You want to also say, I know you can do things, and I know there are times that you need me. But what my caution is, I've urged families to do that vacation, and they'll say, you know what, we're just too scared. And I'll say, don't do it then. You have to be ready yourself. You can't take a risk that you're not ready to bear either. But I caution that when you deal with a lot of dependency, if you buy into that as being necessary, you're basically saying to your daughter, I know you can't do without me. and that's really not the message you want to give. The message you want to give is, I know you can do, what about, this or that? How could we find a way where I can do the trip that I need to do, and what do we put in place? Try to, again, collaborate, not solve it for her, see if she can bear taking this step, because if she can make steps that shows her that she can manage without you, that's going to build her confidence and her sense that she can move forward. So you don't want to enable or somehow be part of the problem.
Yeah. So if I can insert one thing that came to my mind, and I'll just get your reaction and see. But as I'm thinking about it concretely in terms of what the parent's going to actually say to the daughter and how that's going to flow, my sense is that validation is a good way to start.
Yes. To
say, I know that you're panicked. I know you don't believe you can live without me. I know you think you're going to fall apart or something bad's going to happen or I'm never going to come back or whatever, or they don't love you enough that I'm choosing my sister in Florida over you, or that you're not sick enough, that somehow, or whatever. I get all of those concerns, and I really do get them. And at the same time, I have a life, my sister has needs, she needs me, I need to go and help her, I need to do this thing, and I want to work with you on how you're going to be okay in all the ways that you kind of outlined. But as I was thinking about it, I can easily hear it turning into an argument if the conversation starts with, how are we going to make this okay for you? It's going to be tears and tantrums of, I'm not going to be okay, I'm not going to be okay. Whereas I think if a parent maybe starts with the validation, and it can be 1 minute, 2 minutes, and then goes into that, and then when the tears and tantrums come, revalidate, I know this is really hard for you, and yet I'm going to Florida.
Well, I would say the only way I would sort of amend that, Chris, is I would say I really like this starting with validation, which is, I see that it's really, really hard for you when I go away, and that you don't want to make it. Can you tell me more about why it's hard for you? So first of all, I would explore. You may have your own ideas about why it is, and she may have told you and all that. But again, getting her to express what it is she fears, and to say that this is very important for me to know, and I suspected some of that. And at the same time, I need to find ways to sort of do things that are important for me. So I would be careful not to say, like, my sister needs me, because then it'll be a fight between who do you love more, or something like that. So I think there are lots of pitfalls that you can fall into. But the idea of it's also very important for me to do these things. How could we figure this out together? What might, what do you think might help? And I think you'll be surprised if you can do this in a calm way, in a yes, I see how hard this is for you, and not get dysregulated. Because when parents hear their kids say, I don't know, what if I get suicidal? It freaks parents out, So if you just say, well then what would you do? How could we problem solve and think about this, and also have me be able to do the things that I need to do in my life. So I think the validation can really help open things up. There are just lots of ways. When you get somebody who is very dependent and desperately dependent, and that's the thing I would say about BPD, when they have these emotions, it's life or death. So if you go to Florida, I will probably die, and they feel that way. And I think parents often go, I just can't deal with it, I'm not going to go. But I'm saying that there's a price to that. And if you can sort of bring up this idea of collaboration, and even having a short visit, or, really, really brainstorming how to do even part of it, And I think if you would avoid saying, and I'm going to go no matter what, because then that will blow everything up. But let's find a way, that we can figure this out. I mean, I just with a family recently who they wanted to go to a wedding, and the daughter didn't know if she wasn't going to go. They were afraid to leave her at home. If she came, they were sort of worried how it would work out. And so it was like if she didn't go, the dad would stay home and the mom would go, but then that felt hard. I mean, but they wrestled with it, you know, and ultimately knew that there was a risk either way. Either if they didn't go, there was a risk. If they did go, there was a risk. So I think when you're thinking about change and about entering into your needs in your life and not just being, especially with a very dependent person, not always being there for them, it can really promote change. And I want to just say one little anecdote, and it's just a wonderful little story of a mother who was a nurse. If you're a mother and a nurse, it's a double whammy, and you have a dependent daughter in this case, because she had lots of little medical things all the time. And she would call her mother every day. Her mother was a visiting nurse and was out and about, and it was just constant. And she was, you know, struggling and in treatment and stuff. So one of the things we figured to do is that they would go to, they both like to go to tea in these little places where you have tea that are very girly. And I remember talking with the mother about setting aside a time to do something special with the daughter. And she was like, oh, I already do so much. But it was sort of like set aside a time that you just have for her. And they did this, even though the mom was a little skeptical. It decreased the other calls because it really shored up the fact that the mother really wasn't just responding to a crisis, but actually loved the daughter. They did this thing that they like to do together, and it really helped decrease. So sometimes it's paradoxical what you do, but if you're always with her because she needs you, we have to, that's a message you want to break. You want to say, I want to be with you because I like being with you, and then I also have other things to do. So
great. So the second question related to dependency and an over-dependent child. So my daughter just started going to counseling and has asked or mentioned to have me go with her to her therapy appointment. I am desperate for her to get help, but I don't want to go with her because I fear it will jeopardize her experience. She's struggling so much with being very dependent on me, and I feel like she needs to gain her own independence and her own recovery. I myself have had my own counselor for 3 years because BPD has just taken such a toll on our lives. So any thoughts about this mother's reservations about even getting involved with the treatment, kind of wanting the daughter, like, go out, have your own treatment, have your own therapist, have it private from me, don't even involve me.
Yeah. Well, again, I have the paradoxical response. Absolutely go with her once. The hope is that the therapist, you can go in and say, this is my worry, you know, that there is this dependence, and you can present to the therapist your concerns about even being there and, you know, that kind of thing. So it would be very good for that to get into therapy. Refusing to go is a problem. You want to trust that the therapist can manage this, because the therapist, my hope would be, this is an individual therapist. They're going to say, maybe at most what I've seen individual therapists do, which I think could be helpful, is say, why don't you occasionally join us to talk about how things are going? Because it's, so I think you want to lean in and present the problem and then step out rather than refuse to go with her. So again, it's a little paradoxical. You're sort of like, my sense is that I shouldn't go to her individual therapy. But bringing this up with the therapist and having the opportunity to do that would be terrific and would bring it in the room for the therapy and make it much more alive.
Okay. So the next question, and it's a common one, and you alluded to this and even mentioned that my daughter's been diagnosed with BPD. She's in her 20s, is mostly independent, but holidays are always stressful with extended family, often resulting in her having a breakdown. And I'll just add for, the drama or something happening. Any techniques for parents or family members or spouses, I mean, it's really kind of all the same. Any techniques for loved ones to deal with it?
I think you have to lean right into this problem. And I think about the family work that I do, a lot of it is focused on weddings, holidays, celebrations, anniversaries, all of that. Because whenever there are family gatherings, a person with BPD has a lot of anxiety about how they present and what's going to happen socially. There's usually a lot of social anxiety. So actually sitting down and planning this out. And I think that is the way to do it, rather than you either go or you don't go. I mean, there's always an option for the person to not attend. But that's also a downside for the person who often wants to see some people or wants to be part of the family, but then is so worried. So, you know, there are strategies like, you know, let's think who's going to be there, who will you sit with, who can you talk to that's kind of safe. Do you want to give me a high five if you want to leave and I'll give you a ride home? You know, like these kinds of things, so that you can really be an ally to the person with BPD and kind of say, you know, what is, if you were able to do it, what would you need? What would be helpful? And I've had parents say, you know, just give me a signal and I'll drive you home, you know, or back to the hotel room or something like that. And then I think the person with BPD feels like, you know, okay, I have some protection. I have some strategies for managing it. They may bail and not go at the last minute. That's also very classic, but it's really, they're between a rock and a hard place. If I don't go, I'm miserable. If I go, I'm miserable. So I think what you do is kind of say, okay, you know, Aunt Martha is a nightmare. We all avoid Aunt Martha. You know, if she comes up to you and talks, just wave across the room, or, you know, this is what you can say is, oh, I have to go to the bathroom. Or so if you really, you know, instead of saying, oh, you're, you know, she's such, you know, she ruins every holiday, anticipate what the problems are. And that's not to say that you can't still have a meltdown, but kind of just anticipating, again, without judgment, you know, are you going to be all right, or are you going to throw a fit, you know, kind of thing. You don't want to present it that way. You want to say, you know, if you do want to go, what would help you manage it? So again, the idea that people with BPD, they don't change who they are. The treatment is about developing ways of managing, knowing anticipating your emotional reaction and managing it in a better way. So you want to go along with that.
Great. So the next question is about dealing with a child who's kind of avoiding, shunning, closing you off from life, and it's a common theme as well. So what are your thoughts on addressing issues in writing? Our son avoids us, hides in his room, pushes back, and says all the things that you mentioned in the you need therapy dialogue, shuts down. Is there ever a role for writing letters or sending him emails just to even try to progress the conversation and start the exploratory process that you mentioned to hopefully lead to him getting treatment?
Well, that is one that comes up all the time. And don't forget to put texting in there. So as bizarre as it might be to text or email your kid who's downstairs from you in the same building, in the same house, it is a way. I think writing can be very important, because people with BPD often, they're so reactive that even the look on your face or the way you're saying something or some trigger word like, well, how are you feeling today, you know, can just kind of set them into sort of negativity. What I would urge people not to do is long emails, long letters, because they won't be read. That's the one thing. The shorter, the better. And I think if you begin to open up some kind of dialogue, even on texting, around neutral things like, are you coming up for dinner? Or, you know, like, are you going to use the car today? Or something like that, to start to introduce, and I would say texting is the best format. Emails, people don't open emails, and people with BPD often avoid, they certainly don't read letters, and they don't open mail a lot of the time when they're not feeling great. And emails, if there isn't texting available, emails, you want to make them short. So it can be a forum as long as you don't, again, poison the water by doing a long, elaborate, message that has too much stuff in it. So you want to have it, you know, just start off by maybe using that form of communication in a neutral way, and then maybe possibly, I think it works out really well because people can read it and take it in, but it has to be simple. And it can't be what you just want. You want to try to frame it differently to see if you can enter into it. So I don't know if that makes sense, but I do think a lot of people text and email their own family members in their own home. It's not unusual at all. And that's sort of the way now, unless somebody doesn't use a phone or computer, which I don't know who that would be, but, some people do write, and, letters can be potentially useful. I don't know what the situation is, but I have seen people react to the first 2 lines in the letter. So people that I work with, if they want to write an email, I'll tell them, send me the email first, and I can see if it looks like, no, don't start with that line. Start with this and kind of ease into what you want to ask, if that makes sense. But short and sweet.
And what do you think of, again, because I'm trying to look for themes and patterns so that it will make things a little easier for parents.
Mm-hmm.
So what do you think of the theme of start with a validating sentence?
Yes. Mm-hmm.
I know you're really furious with us, or I know you're really angry at me.
Mm-hmm.
I hope you know that I love you very much, and I would love to find a way to help you, but I don't know how.
What's even more powerful, and this is, again, where I love those family guidelines because they're so simple, if you find the nugget, don't get defensive when there's a criticism. Speak to the nugget of truth, in the bucket of sand. So along with the validation, like, I know you're really upset. I regret talking to you in anger and losing my temper. Owning something yourself will also open the door. And then to say something like, we need to figure out, how to do this in a better way. Can we talk? Or something like that. So I think you're right, Chris, about, first of all, writing if they're not talking to you, this is your only way of doing it. But to really start with compassion, avoid any criticism, admit whatever you've done that is true, but don't say, I'm so horribly sorry for how terrible I was. You want to keep it more neutral, I regret losing my temper. I'm really working on that, kind of thing. So to try to keep the drama low, but own your own stuff, and that can engage as well.
Great. So the next person asks, so if you have a child who's kind of refusing to get treatment, is there a role for family members to do a DBT training course or learn about DBT themselves or learn about other treatments themselves and then try to use some of those techniques or tools with their loved ones?
Absolutely. There's, I did multiple family groups for many years, and I would say maybe 30% of them had a family member who was not in treatment, but they got enormous. The more skillful you can be, this is my mantra, that you can make things better for your family member and open up communication. The Family Connections program, which is also a phone, you can do it by phone or in person. I urge people to sign up for that. There is no question that learning more DBT skills, communication skills that are targeted for BPD work with everybody, with all people in your life. So it's a win-win situation. And I think it really helps families when they're frustrated that their family member, that they do something, and this would be, rather than just keep harping on your family member who avoids you now at all costs, learning yourself is terrific.
So the next one is a bit of a difficult dilemma, but again, sadly, not uncommon. So this person writes, it's a parent. Parent writes, it's extremely difficult to communicate with my son as I seem to be his biggest trigger, yet I'm the one parent that's most familiar with his condition. He goes into rages very easily. He was just hospitalized for the 3rd time in 1 year. talking about any treatment at all gets them enraged, and then it leads to you're the one that needs help. I'm so terribly concerned. I see him going on a downward spiral. He's only 18 years old. I've had a couple of meetings with therapists that have been very stressful because he becomes really confrontational with the therapist. And so having somebody who has these anger, rage attacks is clearly, in and out of hospitals, blames you even though you're the primary caretaker. Any thoughts, suggestions, recommendations for the poor parent in that position?
So it sounds like this is a two-parent family?
It's not clear from the communications that it is.
So if you're, if it's a two-parent family, either intact or divorced, it doesn't matter. What jumps out at me is that if there is a partner available, even if you know your son better and you feel like you understand and are more involved, and sounds like you really are, that bringing in the uninvolved parent can really help. Even if, and this is often I have mothers that are very involved and fathers that are like, oh, I have a great relationship with my kid, we never argue about anything. Well, they never talk, So bringing in another parent or another, significant other that's involved to help maybe be more, because your relationship is now charged and reactive and volatile, and it's going to quickly trigger like that, especially when you have a son who is this prone to anger, has such difficulty modulating that. So having a partner, especially if there's a parent, even if you feel like your spouse or your ex is not up to the task, if you could meet with a family person, just the two of you, and develop a strategy for this, and I'm not particularly saying do family therapy with your son because you're not nearly ready for that, but to bring in, so you're not the only one, to diffuse this and to have somebody else, even if it's, someone who is not as aware of everything. It's amazing how much that can help take some of the pressure, because there's a lot of pressure on the dyad here, and you're in a struggle, and you need some way to sort of break that up a little bit.
Do you have recommendations for what the other parent or what the other just kind of, there's a term charismatic adult, but any other adult, whether it's a neighbor or a teacher or a guidance counselor, or so it could, even for the single parent that is really doing it 100% on their own, they could find another adult who this boy knows and rope that person in. But what would you recommend that person say or do, or what do
nothing.
They do?
About, if he likes cars, talk about cars. You actually don't want to get somebody in there, give them an agenda, and see if they can deliver your agenda. You really want him to just feel connected. And right now, the connection with you, which is so important, is in jeopardy and is frayed. So really what you want to do is help him calm down with distractions, other things. Obviously, it would be great if he could be in therapy, but you're not going to join that therapy. You get your own support, and then the person you're working with and his therapist talk together. I mean, I think that's still the ideal kind of model. You have to, it takes a village. You need more people in that.
Great. The last one, which might be a quick one, my 30-year-old daughter lives on the West Coast. I live on the East Coast. She's been diagnosed with BPD, but has many of the symptoms. She herself is resistant to seeing an individual therapist, but has expressed an openness to family therapy with me. What are your thoughts on phone therapy or Skype video therapy, given our kind of geographic?
It's been revolutionary, having Skype and FaceTime and stuff like that. I do believe that it is best to have a meeting first in person, And if she had somebody identified out there, or if you do here, first of all, I think it's a wonderful idea. I do a lot of phone work, but it really makes a difference for me if I've actually met the people before, even with Skype and all of that. But if you can't get out there for one reason or another, you can just start with Skype. But I think phone work is absolutely possible and doable, and even more so with the technology we have today. But I think there's nothing, if you could have one session in person and really make that effort, if she said, this is what I'm willing to do, that's an open door, and I would really take advantage of that and respond to that.
Great. Thank you so much, Maureen. Our time is up for this webinar. You'll see on your screen the next webinar is Monday, November 9th, Suicide Myths, Realities, and What We Can Do to Help, with Dr. Mark Schechter. So if you'd like to register, you can click on that link and register for that webinar. But I, again, want to thank Maureen Smith for her time and her expertise.